All right, welcome now, and welcome back. And joining me now in the studio is Max Richtman. He's president and CEO of the National Committee to Preserve Social Security and Medicare. Max, you're in from Washington. Thanks for joining me here.
Thank you.
And we're going to talk a lot about this topic in a variety of ways, but let's start because the news of the day really is the Paul Ryan budget. It sounds like it's the same old story coming back, and of course it calls for a variety of cuts in Medicare, Medicaid, and other programs. What is your reaction to that?
Well, our reaction is the same as it was last year and the year before to that same old story. The Ryan budget basically privatizes Medicare. And what they would do over time is, besides raising the age for eligibility for Medicare from 65 to 67, over time you would get a voucher. You'd get a voucher, and you would take that voucher and go out and try to buy health insurance.
And if it's not enough, then you'd have to supplement.
You'd have to pay.
Now Ryan's been playing with that. He's saying it's not a voucher. He's putting it differently now.
You know the expression, you can put lipstick on a pig and call her Sally is still a pig.
Yeah.
That's what we're dealing with. He's made some changes. Allows traditional Medicare to be part of the mix. But the bottom line is this is a way to privatize and end traditional Medicare and the Medicare program. I'm sure you know, seniors, they like Medicare. It's not perfect, has some flaws.
No question about it.
It's a program that people are really very enamored of and very dedicated to. We are as well.
All right. Now, for the sake of balance, Paul Ryan would say, look, this is not true. This is what the Obama administration says. But it seems that everybody, even President Obama, agreed changes have to be made to Medicare. Now, I will say, I'm going to shift topics for a second, but they're also talking about changes to Social Security. But Social Security has nothing to do with the deficit, so I'm not quite sure why that has to be part of this discussion.
You're not alone if you're not quite sure. We've been making the case. I made it directly to the president in the White House 1 week after the election. He invited a group of 9 people, 9 or 10 of us, down to the White House, and we sat in a room. Secretary Geithner, the president, the vice president, the chief of staff, me, and I made the case that I said Social Security is not the problem with the deficit. Social Security has a surplus. Well, let me finish. Social Security has a surplus, has never contributed a penny to the federal deficit each year and to our cumulative debt, and it should be dealt with separately. Yes, there's some issues need to be taken care of in the long run. We've got 22 years of solvency. We don't want to wait till the summer of that last year. And he agreed. He said, we agree with you. So why has this now resurfaced in a very clear way? The message is very clear from the president. He's willing to negotiate Social Security benefits in return for tax cuts to deal with the next crisis, which is increasing the debt limit.
Unless that's a bargaining position that he'll pull away from, that remains to be seen.
Who knows?
Well, who knows? We're going to take a little break here. When we come back, the question gets asked, are same-sex couples shut out of Social Security, the safety net it provides? Max's group has released a new report about that, urging Congress to make vital benefits like Social Security available to all people. We'll explain when we come back. We are back. I'm continuing my conversation with Max Richtman. He is the president and CEO of the National Committee to Preserve Social Security and Medicare. You guys have just done a study now, Max, which actually indicates, in Illinois is talking a lot about same-sex marriage, whether it will pass. But on a federal level, some people say, well, we have civil unions, so you're fine. Everything's taken care of if you're a same-sex couple. But you've looked at Social Security on a federal level and said it's just not true.
It's absolutely not true. There are benefits. Social Security is a dynamic program. It's a program that has evolved over time to make sure it is an effective program to take care of American workers, not just in retirement, but disability, death, survivors' benefits, children's benefits.
And that's where the disparity comes in, right?
Exactly
it's
right.
A same-sex couple, and if one should die.
If there are over 3 million children today that get by in life with Social Security benefits, none of these benefits apply to the children of same-sex couples, including death benefits, spousal benefits. So we support a bill that's been introduced by Congresswoman Linda Sanchez, the Social Security Equality Act, H.R. 4600. It would, by law, require Social Security to apply the same consistent rules to same-sex couples in terms of survivor benefits, spousal benefits, children's benefits, as are applied to heterosexual couples. And it's time. It's time. And I know your Senate has recently, I think, passed
it's in the House
law,
now.
and it's now before the House. So,
but that won't fix things on a federal level.
Absolutely
That's about state
absolutely
issues.
Not.
And let me ask you as well. I mean, look, there should be a line between church and state, right? The religious beliefs. And it seems to be religious beliefs that get in the way of the gay marriage issue. What is the argument, if you're going to make an argument to Congress, what is the argument to say, look, in terms of civil rights, this is critical? What do you say to the very religious congressmen or senators who say we just can't do this?
I talk about what's fair. What is fair? If you have a couple, a committed couple in a relationship, whether a same-sex partnership, same-sex marriage.
But they say it's not God's will. God doesn't recognize that.
Well, Social Security Administration has done a lot of positive things. And I don't think they follow necessarily God's will. They're trying to do what has been fair for many years. As I said, it's an evolving program. When Social Security started, it didn't have all of these benefits that are now so important to the American people. Mm-hmm. And they need to be extended to same-sex couples, and it is a matter of fairness. I think more. You've seen a change. You've seen a change in your legislature here.
Absolutely. Well, public opinion has changed quickly,
dramatically
on this issue.
So the law needs to keep up with public opinion.
Is this issue at all? Were you guys involved at all in an amicus brief or anything before the Supreme Court with the decisions they're rendering in later this month?
Not in this. We were involved in an amicus brief on the Affordable Care Act.
Okay.
In a very big way, and we won. And I think there are many seniors right now, I know I'm changing the subject on you, who have benefited enormously from the Obamacare, the Affordable Care Act. And part of we started talking about the Ryan plan.
Yeah.
Ryan budget repeals Obamacare. Okay, you lose the discount for prescription drugs. You lose the benefits, no out-of-pocket costs for a wide variety of preventative cares. All that is gone on the Obamacare.
Some say that's why the Republicans need to realize they lost that election, and then people spoke on that issue.
Last year they voted 32 times.
Right.
On repealing.
And 33 might be coming up. Max Richtman, President and CEO of the National Committee to Preserve Social Security and Medicare. Thanks for being with me. I wish we had more time, but we don't. I'm Paul Lisnick. See you tomorrow night for more politics.
Thank you so much.